We're going to move on now to Dr. Tseng. And Eric, what about people who have had a blood clot in the past and they receive their, or continue to be receiving their blood thinners, and sometimes they may have additional x-ray tests to determine if the blood clot is still there. Can you comment on, is that really something that's necessary? And if so, how can we address it in this sort of social distancing time?
So the question that Jim is asking is the scenario where, let's say you've had a pulmonary embolism or a deep vein thrombosis, and then at some point, maybe 3 or 6 months down the road, while we're still in the midst of the pandemic, the question comes up about whether you should have repeat imaging to see what's happened to the blood clot. The short answer to this question is no, that we generally would not recommend repeating the x-ray or ultrasound to see if the clot in the legs or the lungs is still there. And the reason is twofold. Firstly, in most cases, the presence or the results of repeat imaging tests will not change the treatment decision about how long to continue blood thinning medication for. And the second is that it's obviously difficult to get repeat imaging and it makes social distancing challenging. And so in general, we would not recommend routinely that you have repeat imaging. To that, the first is that there may be situations when your doctor feels that repeat imaging is helpful. You should speak with your provider specifically about that after discussing the benefits and risks of doing that testing. Secondly, if you do have symptoms of a pulmonary embolism or a deep vein thrombosis that come back, you should seek medical attention. But I do want you to keep in mind, in most cases, if it's a pulmonary embolism that you had and the chest pain and shortness of breath have gotten better or resolved on blood thinning medication, if it's leg pain or swelling that's gotten better on blood thinning medication, in most situations that means that the clot has either gone or substantially reduced in size. And so that's a really important message to keep in mind. And we have to make these decisions carefully to ensure that we keep safe with social distancing.
I fully agree, Eric. A lot of times these tests are not needed even outside of this COVID-19 era.